Have you ever bitten into a fruit thinking it's doing wonders for your health, only to later discover that it might be causing harm instead? You're not alone. In fact, a staggering 65% of seniors unknowingly consume fruits that could be harmful, particularly if they are managing chronic conditions such as diabetes, kidney disease, or heart problems. Take, for instance, Martha, a lively 72-year-old woman who believed her daily fruit bowl was the key to her longevity. Little did she know that one particular fruit in her selection would send her to the emergency room with severe heart palpitations. The truth is that certain fruits, while seemingly harmless, can pose serious health risks as we age. In today's discussion, we will uncover 6 fruits that seniors should avoid, and the reasons why. Even small quantities of these can be dangerous. Stick around until the end, as the information you gain today might just help you steer clear of life-threatening complications. Before we begin, I'd love to hear where you're watching from, so drop a comment below. Also, if you haven't already, hit that subscribe button and turn on the notification bell to stay updated with essential health tips for seniors. Your support helps spread crucial health knowledge, ensuring a better and healthier life for our aging community. If you find this video helpful, comment with the number 1. If not, comment 0 so I can make improvements and provide better content for you. Now, let's get started. Let's begin with a fruit that looks innocent but carries a hidden danger: star fruit. Its unique star-like appearance and exotic appeal make it seem like a fun, healthy treat. However, it is among the most dangerous fruits a senior can eat. Having worked with older adults for years, I have witnessed the severe consequences that come from consuming this fruit, especially in people over 60. Star fruit contains a potent neurotoxin called caramboxin, which can have serious repercussions for the nervous system. While a younger person's kidneys can filter this toxin effectively, aging kidneys are not as efficient, leading to an increased risk of toxicity. Research from the Centers for Disease Control and Prevention, CDC, indicates that 1 in 3 individuals over 65 has some degree of kidney dysfunction, often without realizing it. For seniors with compromised kidney function, consuming star fruit can trigger life-threatening complications. Even in small amounts, star fruit has been found to cause dizziness, confusion, and in extreme cases, seizures. Take John, a 72-year-old from Tampa, Florida, who took pride in making healthy food choices. Thinking he was adding variety to his diet, he incorporated star fruit into his morning smoothies for a week. Initially, he felt fine, but soon he started experiencing unexplained dizziness and confusion. Concerned, his family took him to the emergency room, where doctors discovered that star fruit had triggered severe neurotoxic effects. The symptoms were worsened by an undiagnosed kidney condition, which only came to light after his hospitalization. John was shocked. "I had no idea something so small could cause so much harm," he later admitted. The National Kidney Foundation has long warned about the dangers of star fruit for people with kidney issues. Symptoms can range from nausea and vomiting to seizures and, in extreme cases, coma. These aren't just rare incidents. Many seniors experience severe reactions to star fruit, and the trend is growing. If you often feel fatigued, have swollen ankles, or experience sudden unexplained weight changes, these could be early warning signs of kidney issues. If you have any doubts about your kidney health, consult your doctor. Meanwhile, it's best to avoid star fruit and opt for safer alternatives like Asian pears or dragon fruit, both of which offer similar health benefits without the associated risks. Now, let's discuss another fruit that may be sitting in your fridge right now: grapes. These sweet, juicy clusters seem like a perfect, convenient snack, but they can be surprisingly harmful for seniors. As a healthcare professional who has worked with thousands of older adults, I feel it is important to highlight why grapes are not the best choice for those over 60. Now, I'm not saying you should completely eliminate grapes from your diet, but it's worth considering safer alternatives that provide similar benefits without the risks. Fresh berries, for instance, are packed with antioxidants, lower in sugar, and easier to chew and digest. Melons, when cut into small pieces, are hydrating, refreshing, and much safer to consume. These options not only help maintain stable blood sugar levels, but are also widely available at reasonable prices. If you still prefer grapes, a simple precaution can make a big difference. Cut them into quarters and limit your intake to no more than 6 pieces at a time. This significantly reduces both the risk of choking and the impact on your blood sugar. Pairing grapes with a protein source, such as a small piece of cheese, can also help slow down sugar absorption, making it a much safer snack choice. If you find this information helpful, let me know by commenting below. Your engagement helps me understand which topics resonate most with you. Now, let's talk about another fruit that, despite its reputation for boosting immunity, might not be the best option for those over 60: oranges. We all know that oranges are rich in vitamin C and can support immune function, but there are a few crucial aspects that often go unnoticed, especially among seniors. Many older adults don't realize that oranges can trigger acid reflux, interfere with important medications, and even lead to dental health issues. Research from the GERD Foundation shows that nearly 60% of people over, say, experience acid reflux, and citrus fruits, particularly oranges, are a common trigger. Margaret, a 73-year-old patient from Minnesota, was convinced that eating an orange every morning was helping her stay healthy. However, she soon began experiencing frequent acid reflux, which disrupted her sleep and left her feeling uncomfortable throughout the day. I never imagined that something as simple as an orange could be the cause, she told me. But after eliminating oranges from her diet, her symptoms significantly improved. There's a particular food that has gained immense popularity for being a superfood: the avocado. It is often celebrated as a staple of a well-balanced diet. But for those over 60, it's essential to pause and reassess whether including it in your daily meals is truly beneficial. While avocados do offer numerous health advantages, their nutritional profile is not as simple as it appears. They may introduce unexpected concerns related to weight gain, medication interactions, and allergic reactions. Before making them a regular part of your diet, let's take a closer look at these issues. To begin with, let's talk about the calorie content. Avocados are packed with healthy fats, but they are also highly calorie dense. A single medium-sized avocado contains around 40 calories, which is roughly equivalent to a full meal. As we age, our metabolism naturally slows down, and our overall energy requirements decrease, as noted by the American Heart Association. Many seniors, unaware of the calorie impact, may unintentionally consume more energy than their bodies require. Take the case of Robert, a 75-year-old man from Denver. He decided to add avocado toast to his breakfast routine, believing he was making a smart and healthy choice. However, after 3 months, he had gained 12 pounds. This unexpected weight gain exacerbated his joint pain and left him feeling lethargic. The lesson here is that while avocados are nutritious, consuming them in large quantities without monitoring portion sizes can contribute to unwanted weight gain, which is particularly problematic for seniors. Another significant concern is how avocados may interact with commonly prescribed medications. Research indicates that avocados can influence the absorption of certain medications, including blood thinners, blood pressure drugs, and even some antidepressants. Seniors often manage multiple prescriptions, and the last thing they need is an unnoticed food interaction that could compromise their treatment plan. Unfortunately, many healthcare providers do not always discuss these interactions in detail, leaving patients unaware of the potential risks. Being mindful of how food choices can influence medication effectiveness is an important aspect of overall health management. Beyond medication interactions, avocados can also trigger allergic reactions. This is something many people don't anticipate, especially if they have eaten avocados without issue in the past. Avocados contain proteins that closely resemble those found in latex, making them a potential allergen for individuals with latex sensitivities. Studies suggest that approximately 6% of seniors over 65 may develop this sensitivity. The surprising part is that new allergies can emerge later in life due to changes in immune function. If you experience symptoms such as itching, swelling, or digestive discomfort after consuming avocado, it may indicate a developing sensitivity that should not be ignored. So, what are the alternatives? There are plenty of heart-healthy options that provide similar benefits without these potential drawbacks. Olive oil, for example, offers the same healthy fats as avocados, but is much easier to control in terms of portion size. If you're looking for nutrient-dense foods that won't interfere with medications or cause allergic reactions, consider small servings of nuts, such as walnuts or almonds. These provide essential nutrients and are often more cost-effective than avocados, making them an excellent alternative. However, if you still wish to include avocados in your diet, it's crucial to do so mindfully. A safe approach is to limit your intake to a quarter of an avocado per day. Always incorporate it as part of a meal rather than eating it on its own to avoid overconsumption. Additionally, pay close attention to any new symptoms, especially if you take medications regularly. Most importantly, consult your healthcare provider to ensure that avocado consumption aligns with your prescribed treatments. Have you noticed any changes in how your body responds to avocados as you've gotten older? Sharing your experiences can help others in our community make informed decisions about their diet. If you found this information valuable, type "healthy" in the comments below. Now, let's move on to another fruit that many seniors enjoy, particularly on hot summer days, without realizing its potential risks. If you're still watching, drop a comment with the number 2 to let me know you're engaged and following along. Let's discuss watermelon, a refreshing and hydrating fruit that is a popular choice during warm weather. At first glance, it seems like the perfect option for quenching thirst and providing essential hydration. However, for individuals over 60, particularly those managing heart or kidney conditions, watermelon can present hidden challenges. Recent research, including findings from the Cleveland Clinic, highlights an often overlooked fact. Watermelon's high water content can interfere with the body's fluid balance, especially in older adults. This issue is particularly concerning for those with heart conditions or individuals taking diuretic medications, which regulate fluid retention. Take the case of Betty, a 78-year-old woman from Arizona. She believed she was making a wise dietary choice by eating watermelon regularly during the summer to stay hydrated. However, within just a few days, she experienced significant fluid retention, leading to shortness of breath and, ultimately, an emergency room visit. Unbeknownst to her, the excessive water content in watermelon had overwhelmed her body's ability to regulate fluids, a common issue for seniors whose kidney function may decline with age. This excess fluid buildup can strain the heart and lungs, creating a scenario that is best avoided. Another concern with watermelon is its sugar content. Although it appears to be a light and healthy snack, watermelon has a surprisingly high glycemic index. This means it can cause rapid spikes in blood sugar levels, which can be problematic for seniors managing diabetes or those at risk of developing the condition. According to the American Diabetes Association, consuming just 2 cups of watermelon can have an effect on blood sugar levels comparable to drinking a can of soda. Understanding the hidden risks of seemingly harmless fruits like watermelon can help seniors make more informed dietary choices. Moderation is key, and for those managing specific health conditions, it's always best to consult a healthcare professional before making significant dietary changes. As we grow older, paying attention to what we eat becomes increasingly important. Some fruits, though seemingly harmless and refreshing, may pose unexpected risks to our health. This is especially true for those managing chronic conditions such as high blood sugar and kidney issues. Let's take a closer look at 2 fruits that require special caution for seniors and how to enjoy safer alternatives. Watermelon, often seen as the perfect summer treat, can actually be problematic for those keeping an eye on their blood sugar levels. Despite its juicy and mild sweetness, watermelon has a high glycemic index, meaning it can cause blood sugar spikes. For seniors who are managing diabetes or insulin resistance, consuming watermelon in large amounts can make it difficult to maintain stable glucose levels, leading to potential health concerns over time. Another crucial area of concern is kidney health. As we age, kidney function naturally declines, with nearly 40% of adults over 65 experiencing some level of reduced kidney efficiency. This means the kidneys have a harder time filtering out excess potassium, which is where watermelon becomes a risk. Since watermelon is high in potassium, excessive intake can lead to dangerous imbalances. When potassium levels build up in the bloodstream, it can contribute to irregular heart rhythms, a serious condition that many don't immediately associate with fruit consumption. Those with kidney issues should be mindful of their potassium intake to prevent complications. So, what are some safer ways to stay hydrated during warm weather? Consider replacing watermelon with alternatives such as cucumber slices infused in water, which provide a refreshing, hydrating effect without the sugar overload. If you're craving something a little sweeter, frozen berries make an excellent choice, offering a cooling sensation without the risk of blood sugar spikes. These options are widely available and just as satisfying, allowing you to enjoy a refreshing snack without unnecessary risks. For those who still want to enjoy watermelon, there are ways to do so more safely. Keep your portion size small, no more than half a cup at a time, and always pair it with a protein source like nuts or cheese to slow down sugar absorption. Also, avoid eating watermelon late in the evening, as fluid retention risks are higher at night. If you notice swelling in your legs or sudden shortness of breath, it may be a sign that your body is struggling to process excess fluids, which could indicate a strain on your heart. Being mindful of these factors will allow you to make smarter choices without completely giving up on a fruit you enjoy. Now, let's turn our attention to papaya, another fruit that seniors should approach with caution. While it's often praised for its digestive benefits due to the enzyme papain, it may not be suitable for everyone. Many older adults take medications for blood pressure, diabetes, or other chronic conditions, and papaya has been found to interact with these treatments in potentially harmful ways. The U.S. Food and Drug Administration has highlighted concerns about how papaya may interfere with blood thinners, diabetes medications, and certain antibiotics. For example, those on blood thinners may experience an increased risk of bleeding due to the way papain affects clotting. If you are on any long-term medications, it's important to discuss potential food interactions with your doctor before adding papaya to your diet. A real-life case illustrates this issue well. Helen, a 1-year-old from San Diego, began eating papaya daily to aid digestion. However, within a week, she noticed that her blood pressure medication wasn't working as effectively. After consulting with her doctor, she learned that papain was likely interfering with the absorption of her medication. This experience highlights the importance of being aware of how even natural foods can impact medication effectiveness. Another factor to consider is the link between papaya and latex allergies. Research indicates that approximately 30% of people with latex allergies also react to papaya. What makes this particularly concerning for seniors is that allergic reactions can intensify with age. Symptoms can range from mild itching or hives to severe breathing difficulties, especially for those with pre-existing respiratory conditions. Even if you've eaten papaya in the past without issue, your body's response may change over time, so it's crucial to stay vigilant. Moreover, while papaya is often recommended for digestive health, studies suggest it may not be ideal for older adults. Research published in the Journal of Geriatric Medicine reveals that many seniors experience bloating, acid reflux, and stomach discomfort after consuming papaya, particularly on an empty stomach. This is due to the fact that aging digestive systems become more sensitive, making certain fruits harder to tolerate. If you find that papaya causes digestive distress, it may be best to opt for gentler alternatives. For those looking to support digestion in a safer way, probiotic-rich foods, such as plain yogurt, kefir, and fermented vegetables, offer excellent benefits without the risks associated with papaya. Ginger tea is another great option, known for its soothing effect on the stomach and can be easily found in most grocery stores. These alternatives help maintain digestive health while avoiding potential complications. However, if you still wish to consume papaya, there are a few precautions to take. Avoid eating it on an empty stomach to reduce the chances of digestive discomfort. Always consult with a healthcare professional or pharmacist to check for potential medication interactions. If you're trying papaya for the first time or after a long gap, start with a small amount, just 2 to 3 pieces, and observe how your body reacts. If you notice any unusual symptoms, such as skin irritation, stomach pain, or breathing difficulties, stop immediately and seek medical advice. Now that you're aware of the potential risks associated with these fruits, I'd love to hear your thoughts. Were you surprised by any of the information shared? Do you plan to adjust your diet based on these insights? Share your takeaways in the comments below. Your experience might help someone else make healthier choices. If you found this video helpful, don't forget to like, share, and subscribe to Elderly Hacks for more essential health tips designed for seniors. Your support helps us to continue bringing valuable information to help you live a healthier, more informed life. Thanks for watching, and I'll see you in the next video. Stay healthy and take care.